LSATs and GRE, and I just bought like a review book, but that may be why I didn't do quite as well as some of my friends.
So interestingly enough, I should point out, Rory and I were both accepted to law school and chose to go to careers in public health. So we had kind of both been down the law school path about applying and looking for recommendations and through the entire thing. I took a prep class for the LSAT. I did not take a prep class for the GRE. In retrospect, I think it would have just helped if I had just had a more organized method of studying. So I would support it.
It's kind of like the ACTs and the SATs. So, I mean, I knew I wasn't a very good test taker on those, so I started studying early. So just sort of gauge from your past experience with standardized testing how much you need to prepare. And remind yourself, too, that it is, I know it counts, but it is just a test. So really highlight, I'm a real person, and, like, I'm really motivated, and I have X, Y, and Z to offer. So don't, get really discouraged if your score isn't right in their prime zone. It doesn't matter too much.
I just wanted to say something else about recommendation letters. Most likely for grad school, you won't be asking your co-op person for recommendations if they want academic reference. But what I can tell you is that the more work you put into it, and the earlier and the longer timeline you give people, the better for you. Because I get about 20 students all asking me like 5 days turnaround. Like, sorry, I can't. Like, I have to actually I like to write you a good letter so you can get in, and I like to spend at least a half an hour on it. And right now we're in the middle of 100 resume referrals or whatever, so I can't do it. So, the easier you can make it for them, have everything you need, write down a summary of what you wanted to cover, remind them of when you took the class. I'll have students that I worked with at a school 3 schools ago, and I'll be like, can you write something? I'm like, sure, I remember you, but I have no idea when you joined student government or when you did this. So, anything you can do to make it easier for them, the better. And don't wait until a week before. I mean, we need at least to give a month, if not more, when we ask for a recommendation letter. And ask if they have something good to say. Okay? Because if they don't, and it's just going to be really basic, then you want to ask somebody else. Because some professors won't know you. And even though you want them because they're a big name, it's more helpful to get someone who may not be as big of a name, but knows you.
I was just in a panel with 2 admissions officers. This was for law school, but it goes across the board. The big name is useless if they don't know who you are. It's who can really write about you with some detail and with some knowledge and really promote your candidacy. The other thing is, give them an out. If you are not positive that this person is going to write you a glowing letter, ask, would you be able to write me a letter of reference for blah, blah, blah? Or, are you too busy? It's fine. Give them an easy way to say, oh, I'm really sorry, I am kind of busy, rather than say, no, because I can't write you a good letter. I mean, nobody's going to say that. Then they'll write a mediocre letter, and it's not going to serve your best purposes.
And I think you want to make sure you thank them and keep them posted, because when I ask someone for a letter, odds are I may be returning a few months later to ask them for something else. So just be really thankful that they spent the time to write that on your behalf, and keep them filled in, because if you got into school, that's great. They want to know. They want to brag that, they helped you along the way.
It's a question in the back.
On the health literacy part, I know Julie said you do that. So I'm a pharmacy major, and I'm really interested in the moving problem of medication adherence. And I was wondering if you have done something about health literacy on prescriptions, and especially because prescription labels aren't exactly helpful for many people. Have you done something?
So our organization does a lot with a lot of different researchers at the university. But because we are in health and we work primarily with Bouvet, the pharmacy program here has a really extensive network of research. And yes, we have done quite a few things along that line. If you guys are interested in the health literacy piece, I am more than happy to talk to you about kind of the avenues around that. It's a pretty niche review and research idea, so I don't want to overwhelm, but it's a great method. You are seeing an education component to every health piece that we're going after. I like to think of public health as the non-clinical intervention, and understanding that like where someone lives and the air they breathe and where they work and how long they work and other determinants like that greatly affect their health beyond medication. And so that's kind of one way to really look at public health, is kind of embracing that it is this it's kind of helping the clinical side to work a little bit harder. So.
But I think we're sort of unusual outside of Dr. Mohammed that we don't have clinical background. So I think it's great that you're in pharmacy and you're thinking about these issues, where sometimes I wonder if I had a clinical background, would my effect be
different?
Yeah. So it takes all kinds.
There's another hand out in the back. Yeah.
What would you say are the basic sort of things that a successful community health program like needs to have as like a foundation? Is like a program that's just beginning, or setting something up, like, and like how, like, sort of like what those basic things for success are?
That's a great question. I think with the whole sustainability piece, especially in light of the budget cuts and all that, I think collaboration is really what funders are looking for, and I'm seeing that when I'm applying for a state grant. I have to give this thorough list of everyone the health center collaborates with and then how that specifically impacts the proposed program. But I also see that when I'm applying to like a few $1,000 grants through foundations. So I think finding out, is your program truly like the most original idea ever, or are there other groups doing similar work that you could sort of build off of? Do you have, more specific ideas? It's hard.
Well, I'm doing international club this summer, so I'm going to try and get ideas for just like how I can kind of help where I'm going.
I would say that.
Therapy, so it'll probably do something like exercise and but.
So I think what you need in public health in general, and this speaks to whatever kind of program planning you're looking at. There really isn't something, any program that you do needs to be tailored to the community in which you're doing it, and everyone's part of a community. So it depends on what you're looking for as a community. Are you looking at Dorchester? Are you looking at Latinos? Are you looking, you kind of have to break it down. Elderly people, break it down as to what you're looking at, but all programs have to have a certain level of engagement, an actual feasible list of things that you look to accomplish, a list of the resources you have and how to use them better and what you need, and you need someone beyond yourself to advocate for your program. You cannot be everything to one program, and so that's where that collaboration piece comes in, is that you really need a strong group of people who are helping you contribute resources, go after new resources, and use what you're doing to get further ahead.
We are out of time. Thank you. Let me say, I'm sure your panelists would be happy to speak to you after if you want to come up. But first of all, let's just say thank you.